Early in the pandemic, Fiona Lowenstein knew that the full story of COVID-19 was not being told. She was 26 and healthy, and after testing positive for the virus last spring, she expected an easy recovery. But after a 2-night stay in the hospital, she came home to experience severe fatigue and an upset stomach. She had a difficult time focusing her thoughts, and she was scared. No one had said anything about these symptoms, and after posting on Instagram, she learned she wasn't alone. As co-founder of a queer and feminist collective in New York exploring issues of health and social justice, she suddenly saw purpose in forming a new community. Today, the Body Politic COVID-19 support group has registered 500 COVID-19 patients and their caregivers and families, who have started an independent research group and advised the National Institutes of Health. It is among dozens of grassroots organizations around the world that have formed to make sure that a year into the pandemic, as fatigue mounts, vaccines become more available and infection rates drop, COVID-19 and its lingering symptoms remain in the public eye. Mindful of the battles that HIV/AIDS activists have fought over the years, its members know that their greatest enemies are fear, ignorance and apathy. Mobilizing around the syndrome known as long COVID, members have organized administrative teams and executive boards and enlisted the support of physicians. They write grant applications and mount GoFundMe campaigns, and they worry that long COVID will spark an invisible and untreated epidemic. The pandemic has shaken our infrastructure and belief systems, Lowenstein said. Cracks in the healthcare system and the disability system have emerged. It is clear that the system is not able to meet the demands of COVID patients in general and long COVID. If projections are accurate, their concerns are well-founded. More than 32 million cases of COVID-19 have been reported in the United States, and according to one study, long COVID can affect up to a third of those who have had the disease. Because the full course of COVID-19 is poorly understood, the National Institutes of Health announced in February a $15 billion initiative to study its long-term effects. Activists and advocates believe there is little time to waste. Post-viral diseases like long COVID must be treated immediately, said Emily Taylor of the Long COVID Alliance. Otherwise, they can lead to chronic symptoms. We see a 2-year window, Taylor said, and if we don't get things done, many people will be disabled for many years to come, possibly for the rest of their lives. Angela Mariquez Vasquez, 33, has lived with long COVID for 13 months. She sees 6 doctors, takes up to 25 pills a day and tries not to be overwhelmed managing her health and her jobs as a policy director for a children's advocacy group and on the State Redistricting Commission.